So we do say, don't let the past hold you back, hold back the future of health, because yes, there have been some very tragic and terrible abuses of people of color, of women, and others who have participated in clinical trials. But we argue that to not let the past hold you back from the future of research. It is important that diverse communities participate in research, because outcomes do differ by different populations. And we need diversity in terms of gender, in terms of age, in terms of disability status for people to participate in clinical trials, because we need to know if the things that are being done and being tested and being tried out in these clinical trials, do they work as effectively for men versus women, for young people versus older people, for people who have disabilities versus those who do not, or who are on different kinds of medication, or for African Americans compared to a white population. So this is one way, if you think about it, that participating in clinical trials can help us get closer to health equity by making all types of, by looking at outcomes for all types of individuals across, various demographic spectrum. Next slide, please. So in terms of not letting the past hold you back, clearly, as painful as it may be sometimes, we should learn about the past, learn from the past, and to ensure that those safeguards are in place. So remembering the past and how research harmed people can help us prevent from that from happening again. We should not let the errors of the past get in the way of making advances in the future. It's important for people to know that things have changed for the better. The image that you see on the right, that is an image from 1997 in the East Room of the White House, where then President Bill Clinton actually issued a formal apology for the Tuskegee study of untreated syphilis of African American men. So things are changing. There are more safeguards in place than they were in the past. Next slide. So when we think about what is research abuse is, it occurs when people who take part in research are put at risk, they are intentionally harmed, or they are treated inequitably or unfairly. And research abuse actually goes against the 3 golden rules of research. That being, you have to respect people, do no harm, and that's physical harm as well as psychological harm, and to be fair. Next slide. So just looking back a bit, before the 1970s, there was really not any way to ensure that researchers follow these 3 golden rules. Many research ignored these safety guidelines, and unfortunately, many of these studies that were done that violated those safeguards and those ethical guidelines that we have in place now that weren't in place then, many of the institutions actually approved this work, and even some of our government agencies. Next slide. So I'm just looking at my time. So just want to give you a little bit of a story that is not told as much. Many of us are familiar with the Tuskegee studies, but this is the story of Marion, James and Marion Sims, medical experiments. Wanted to just bring that to your attention, because this is in line with what we're talking about tonight around research on women and research on women, gynecological related research. James Marion Sims, actually, some of you may have heard of some of the headlines that were made in 2017 when we were part of this racial reckoning, that in New York City, where his statue was racist, was actually spray painted on top of it, and they were calls to remove his statue. James Marion Sims is considered the father of modern surgical gynecology, but he is probably one of the most controversial figures in the history of medicine. He had his medical training. He's from South Carolina. That's my home state. He began his practice there, but he did later move to Montgomery, Alabama, to get a fresh start after 2 of his patients died. Next slide. So in terms of who's James J. Marion Sims, he was essentially a plantation doctor who built his reputation among the owners treating enslaved workers. And much of, he actually built a hospital for slaves that he bought or rented and kept on his property, as well as for plantation owners in the communities. And, while healthcare did take place on the plantation, really difficult cases, they did have to come to the hospital. And clearly, much of this was about not so much about just the care of the slave, but if the slaves could not work, they could not produce, reproduce, and they were considered useless for their master. Next slide, please. So let's see what my time. Okay, so Sims is actually credited for revolutionizing women vaginal care and surgery. He actually cared for women who had vaginal fistulas, BVF, and this happened often when women had really difficult child delivery and when the vagina actually separated from the bladder, and it resulted in incontinence, continuous leaking. And our guest speaker certainly could say more about that if you have questions. The instrument that you see on the side in the image is what Dr. Sims actually developed, and his procedures and tools are still the foundation for much of the procedures that we use today. But next slide. But he actually was able to perfect it by experimenting on enslaved African women without anesthesia. And the decision to do, so he literally sliced and sutured their genitalia without any anesthesia. And anesthesia, I will say anesthesia it existed then, but it was still kind of controversial. But Sims actually had the belief that black people didn't feel as much pain as white people, so he didn't feel that bad about doing that, and that's kind of documented in his autobiography. Next slide. And so, I'm gonna sort of quickly go over this. I want to make sure Dr. Census has her time. So the 3 women that he experimented on the most and that are named of the women that we know include Lucy, Antarctica, and Betsy. And Antarctica was a 17-year-old slave woman that he performed at least 30 surgeries to actually perfect his technique. Next slide. But the good thing is that there are lots of, the bad thing is that there are lots of examples of this, but the good thing is that we have really come a long way. Many of these abuses have been exposed, and it did prompt change. So if you could go to the next slide. And much of the change actually just beginning in the 1970s, where we had the National Research Act of 1974 and the U.S. Office of Human Protection that really actually established safeguards. And now all research must be checked by institutional review boards, and every institution that have persons conducting research have institutional review boards. And next slide. So I would just say, as I'm ending up, that in any clinical trial or any research that you participate in, you have the right to informed consent, and that means that you are given all the information that's relevant to help you make a decision about whether or not you want to participate in the study. What do you have to do? How long it takes? What's going to be done with my information? So informed consent is not just about whether you can say yes, but it's also about whether you can say no, because the slave women were not able to say no. So they certainly were able to give informed consent. And last slide. So it is important for us as researchers to acknowledge what happened in the past so we don't make those mistakes again. But it is also important for us to use the information that we learn from this to feel empowered about participating in research and, and making a contribution, because it really is through clinical trials and research that is our best mechanism to find effective ways to treat and prevent conditions that related to women's health and many other areas of health.